Dr. Kevorkian introduced assisted suicide. And in my mind, I determined that that was nothing short but murder and was completely against it. But since that time, I have had some friends that have possibly made me rethink my approach to this subject.
Keith, what do you think about the legalization of the end-of-life pill?
I would need to start that with a little explanation on my training, etc. In July of 1955, I was sitting in anatomy class on my very first day in medical school and heard a professor say, "Everybody deserves the dignity to die." As a 22-year-old young man, it meant very little to me. 4 years later, before I was able to receive my degree from medical school, I had to take the Hippocratic Oath, which said, "I will sustain life to the best of my ability, and I will never do harm." For 40 some odd years, I followed that very closely. I can remember many times working all night long to save the life of a suicide victim, only to turn them into a life of greater distress and possibly greater injury to their own body. Also, times we would spend hours working on patients who had had a cardiac arrest, resuscitating them and bringing them to a substantial life, but possibly being cardiac cripples for many years afterwards. Trauma patients many times were essentially dead when we got them. We actually patted ourselves on the back for saving lives and producing people who were oftentimes paralyzed or partially paralyzed and many times had very low quality of life. But this was all done with the idea that we were to sustain life at all possible costs, and really never gave much thought to what the outcome would be other than that the patient would be alive. Years ago, Dr. Kevorkian introduced assisted suicide with patients. And in my mind, I determined that that was nothing short but murder and was completely against it. But since that time, I have had some friends that have possibly made me rethink my approach to this subject. And I'd like to tell just very briefly about 4 different patients that I had in mind. We had a friend in Florida who had Lou Gehrig's disease, and she was suffering with paralysis and became bedridden. And after she was bedridden, she got to the place that she could no longer swallow. She was given the opportunity to have a gastric tube, which would have sustained her life for a period of time, but she chose to die by starvation, which she did in approximately 3.5 weeks. At that particular time, the pill was not available for end of life, and I've often wondered, being that she'd already made the decision to die by starvation, if she would have been able to take the end of life pill 3.5 weeks before she died, if that would have been more humane. Second patient was a patient that was in ICU, a friend of ours, for over 6 months. She had respiratory problems that were non-curable, and she would be intubated and put on a ventilator for a period of time and extubated with the idea that maybe she could breathe on her own. She was never really given a choice as to whether she was intubated or on a ventilator or not. Finally, after 6 months, she said, "I can't do this anymore." and she asked to be taken off of life support, and she died within 3 days. My sister-in-law was diagnosed with leukemia, and for a number of years was kept alive artificially by receiving frequent transfusions, blood transfusions. But eventually they were no longer working, and she was confined to bed and was in so much pain that she could no longer take care of her own bodily needs, and she wasn't able to even turn over in bed. And so she called me and she said, "I have decided to take the end-of-life pill." It was the first person I'd ever talked to who had actually taken or was going to take the pill. And it was pretty much against my way of thinking. But as I talked to her, she said, "You know, Keith, I just can't go on any longer." She said, "I am just so miserable and so much pain." She says, "I'm 92 years old. There's no reason to think that I'll ever get better." So 20 minutes later, she took the pill with her family and doctors in attendance and went to sleep very peacefully with dignity. The last patient I'd like to mention is a very close friend of mine who has had fibromyalgia for probably about 30 years, but about 10 years ago, after having surgery on an ankle, he had a cardiac arrest and was resuscitated and brought back to life successfully, and actually functioned quite well for a number of years, a couple of years at least, and then developed cancer of the bladder and had to have his bladder removed and a urostomy put in. And then he had a myocardial infarction and had a stent put in, all of which were artificial means that kept him alive and going. And little by little, he deteriorated and has been actually on hospice for now a number of 2 years, I think. But recently he fell and fractured his ankle and now is currently unable to even turn over or move in bed, and his only thought is, "I want to die, but I can't." And now he's at a state of being unable to care for himself, not really desiring to live, not really having any promise of the future, and is asking the question, what would happen if I were to take the end-of-life pill? Now, the conclusion that I would come to on all of this is we are very willing to take terminal patients, put them on IV morphine drips for weeks and months at a time, keeping them essentially comatose, and yet we have questions about whether we should terminate their life at this point. When we have animals that are sick, we have no problem with putting them down and putting them out of their misery. I don't believe the end-of-life pill would be for everyone, and I think it's something that would have to be a definite decision by the individual patients. But my opinion of the end-of-life pill has changed dramatically over the past few years. And now, 40, 50 years later, from when I first heard the statement that everybody deserves the privilege or the dignity to die, I think I'm beginning to understand what that